Good afternoon, everyone. I'm John Sweeney. I'm Executive Director of Children's Place International, and I'm just going to give us another minute to get started as we're waiting for a few others to join in. But we'll get going in just about one more minute. Okay, let's go ahead and get started. First of all, again, welcome to everybody. Thank you so much for joining us today. Today, we are kicking off our annual Place to Hope campaign with a really important conversation about health equity. And I think sometimes for me, health equity can sort of sound conceptual or even abstract, but health equity or health inequity is altogether too real in many communities around the world. And the reality is, and it's really shocking when you see the outcomes across the globe, across the US, and within Chicago, I'm speaking of health outcomes, are significantly different. And there are lots of reasons for this, but one thing that is consistently true is that populations who have been historically marginalized and even exploited often do not have access to critical health resources. So what's the result of that? We see this altogether too frequently, where we see kids, teens, family members suffering and even dying from totally treatable, preventable illnesses, sometimes for want of a couple $100 for a medical treatment. So that's sort of the bad news, but the good news is that change is truly possible. When we come together as a global community, as we are doing today, kids not only survive, but they thrive. And we know this, we absolutely know this from direct experience. In fact, we know it from working from the 5 amazing leaders whom we're going to hear from today, 5 leaders who have dedicated their lives to bringing positive change to their communities. And so with us today are Mina Halpern, Executive Director of Clinica de Familia, La Romana, in the Dominican Republic, Marc Julmiss, Executive Director of Zanmi, Lasante, Haiti, Dr. Esther Majaliwa, Head of Pediatric Oncology, Kilimanjaro Christian Medical Center, Tanzania, and Cinaiya Stubbs, President and CEO of Children's Place Association of Chicago, head of our parent organization and my boss, so please be kind. And we are also so fortunate to have this conversation moderated by Claudia Espinel, who has just been doing awesome work in equity in Chicago and Colombia. So each of our panelists leads organizations partnering with Children's Place International through an initiative called Child Thrive. Child Thrive aims to prevent 10,000 deaths or trauma in young people and to support their journey out of poverty. The Child Thrive Coalition is currently supporting more than 2,000 kids and teens to regain their health and to grow into young adulthood with an ability to secure a livable wage. There are kids in Child Thrive whom, when we first encountered them 10 years ago, were barely making it and are now graduating from college and bringing their professional skill sets in nursing, engineering, IT, and so on to help uplift their communities. So today's a really great opportunity to hear from each of our panelists, to hear their challenges, their successes, and the path ahead, and critically, to hear how we can help. So as I mentioned, this conversation kicks off our annual Place to Hope campaign. Place to Hope is the single largest source of funding for Child Thrive internationally. So the great thing about this conversation today is that it is not abstract or conceptual. Today, you can hear directly from those leading change in their communities and support their efforts today and in the coming months. So Place to Hope runs until the end of the year, and you'll find ways in the chat on how you can support our collective efforts. So thank you so much again for being here today. And now I'm going to turn it over to today's moderator, Claudia. Claudia?
Thank you, John, and thank you, Children's Place, for having me as a moderator today. Hello, everyone, again. My name is Claudia Espinel, and I will be the moderator today. A little bit about myself. I've been working for the last 9 years, supporting nonprofits, creating organizational practices and organizational structures can align the narrative of justice with the work that they are doing with programs and the work that they are doing also with relationship with communities. So I'm excited to hear what our panelists have to say today. So why don't we just go to the four of you now? And let's start, if it's okay with the four of you, with an introduction. So if you can share with everyone your name, the organizations that you work with, where you are connecting from, and also what is front and present for you today as we start this conversation? What is in your heart? What is in your mind as we start this conversation today? So we can start. I'm going to go around in my screen if that's okay with everyone. Esther, I'm going to start with you.
Sure, thanks, Nina. So my name is Esther, and I am actually connecting from Tanzania, a country in East Africa. So in Tanzania, I'm from the north part where there is Mount Kilimanjaro, beautiful weather, so you're all invited. And I am a pediatric oncologist. I head the Kilimanjaro Christian Center, Medical Center, pediatric oncology unit, where we see around 100 to 200 patients with cancer every year. And it's been quite an interesting journey to work there, but also to see changes in children, especially in terms of survivorship. So what's present to me right now is that survivorship or a well-being of a child should not be determined by the country where these children live in. And I think it's uttermost important for us to end children's suffering, no question about it.
Thank you, Esther. Cinaiya, you will go next.
Thank you, Claudia. Dr. Esther is always a tremendously hard act to follow. But I am Cinaiya Stubbs, the president and CEO of the Children's Place Association. I am located in Chicago, the Windy City. And to answer the first kind of reflection, for me, what is so prevalent and present in front of me is just the hate that is in our world today. We all do this work and exist in environments that are challenged in so many ways. And then I think when you layer on how hate permeates our lives on a daily basis, whether it's homicide or genocide or war, and the list certainly goes on, the challenges can seem so very insurmountable, and the issues that we're all trying to address can seem that much more insignificant. The other thing that I think I want to call out is the fact that as I look across the panel of us, the five of us, we are all women, and we all happen to also be women of color. And there is a significant price that you pay, I think, when you do this work, specifically the cost of striving to solve something that is so deeply personal. And not to venture to speak for all of us, but I can certainly think about some of the experiences that I've had as a woman of color trying to raise capital and raise the profile of our organizations in an environment that is still quite oppressive and still endeavors to solve and not serve. So as I think about the collective reason for us all being here, I also have to think about the five of us that are leading this work as women and as women of color, and the fact that the dollars and the support that is raised by these sort of efforts, they help us as much as they help the people that we are serving.
Thank you so much, Naya. I want to highlight the solve and not serve piece of it. So and the need for community. I think we are going to continue talking about that today. Marc, why don't you introduce yourself, please?
Hi, good morning, good afternoon, good evening, everyone. I'm Marc Julmiss. I am the executive director of Zanmi Lasante Partners in Health Haiti. I am actually calling you from on the West Coast in California right now. So we do have quite a bit of difference. I would say there's even approaching the subject, what's forefront, it almost brings me to the point of tears with everything that's happening in my home country in Haiti right now. And I think about the missed opportunities, I should say, in health education for youth. I think about what happened with the earthquake years ago in 2010, and I think about all those children that had nowhere, that had no one, that had a family destroyed, that did not have opportunities necessary for higher education or any education, did not have really a structure in place to welcome them, did not have health in there. So what we have now is this gang situation that you have continues. So I think about missed opportunities. I think another part is I am the proud mother of a 6-year-old son, soon to be 7, as he continues to remind me. And many times I do think this kid has been around for years before, and he would say things like, "Mom, you don't experience what I experience. You can't tell me how I feel." And that stops me, because a lot of times we develop things and put things in place, but we don't know how they feel. So this, a lot of times he was like, "Mom, you're not inside of me." And what puts me in the forefront is how many times I'm telling a youth, adolescent child how they should feel, what they should do, where they should go, without being inside or taking their place inside. So I'm a learner from my 6-year-old right now.
Thank you, Marc. So there we see another piece of like that community building, and how when we build community is as important to be there as to listen to the others. So thank you for that. Mina, if you would like to go next.
Sure, thank you, Claudia. I'm Mina Halpern Lozada. I am the executive director of Clinica de Familia La Romana, and I'm calling in from the Dominican Republic, where I live and work, and where the clinic is located. So when I thought about this question kind of before our call, really the first thing that came to mind is the current immigration situation in the Dominican Republic, and it's really very front and center for our clinic and for the children and youth and families that we serve right now, because many of the families we serve are Haitian or are of Haitian descent, and many of them are undocumented. And I don't know if everyone knows, but over the last year, the government in the Dominican Republic has really been ramping up immigration raids and deportations. And so many Haitians and Dominicans without documentation have been deported. And that includes many of our clients and their family members. So the fear among our clients and among youth particularly has really been pretty palpable. And for our youth, it's resulted in some of them unable to even get to our clinic to get care, to get their treatment, for example, for our youth with HIV, because they're afraid that they might be caught up in an immigration raid and actually be deported. So, also on top of that, people may have heard that the Haitian-Dominican border has been closed for nearly a month, which is dire for both countries. It recently just reopened a couple of days ago, but it's really just not really reopened. And, this whole environment has sparked a lot of anti-Haitian rhetoric in the press, in social media, from politicians in the Dominican Republic. So it's just a very difficult environment right now. And I think Cinaiya was talking about hate and that being kind of front and center, and we're feeling that in a very real way right now in the Dominican Republic. And so trying to provide quality care and welcoming care and youth-friendly care, and making sure that people feel safe here with us, with the care we provide at the clinic, is super important. Our youth are they're dealing with so much. So there's so many other vulnerabilities on top of what's happening with the immigration situation, like food insecurity, insufficient housing, lack of access to quality education, lack of good employment opportunities. So it's kind of just been, probably I said too much and got too much into detail, but it's just been really, when we think of what's top of mind, this is something that we were discussing a lot at the clinic right now and trying to figure out, what do we do facing all of these issues right now?
Okay, thank you, everyone. So now let's do it a little bit more unstructured. And so whoever wants to just jump in the next questions, please just unmute yourself of the 4 of you and share your thoughts. So I'm hearing there are a couple of things that are staying on top of my mind. So we are talking about structures that are not in place, right? So we are in a world that is constantly changing right now. The immigration, the movement of people around the world is not going to stop anytime soon as climate change continues to impact our world, and especially many of the communities that we are all coming from. We are going to start seeing way more waves of migration. Hate, our inability of seeing humanity and seeing humanity across differences, it's something that I heard from the four of you, and how we build the structures that will allow us to bring this generation and next generation to actually live a fulfilling life in this world, right? So as we talk about health equity and health inequity, which is something that the four of you brought up in your introductions, and we think about the ways that health equity and inequity is playing out in your communities. So how does it look like, and why is this conversation so important in this specific moment, and why supporting this conversation is important in this specific moment in history?
I think Marc beat me to the unmute.
No, go ahead.
That's a lot. I would first say that these conversations are important because they expose realities that are unseen by many of us because we don't live them, right? Most people tend to be in a bubble of their own situation or their own circumstance. So these conversations help bring to the fore some other realities that hopefully will give us a different lens, right, to look through, that hopefully then helps us to assess things with more diversity, with more humanity, as you stated, Claudia, and then hopefully that turns into us acting upon that new reality, right? If I think about Chicago as an example, and John alluded to this a bit in his opening remarks, if you take a community like Streeterville, which is a lakefront neighborhood that is in the downtown area of the city. So, the epicenter of the city, super, upper middle class or upper class. If you live there, then your life expectancy is roughly 14 years greater than someone who lives 10 miles due west in the Austin community, which is where I grew up. And certainly there are many compounding and intersecting factors as to why that is, but it boils down to, I think, socioeconomic capital or lack thereof, right? So when you are a have or a have not, and that is a sole predictor of lifelong or of a long life or of premature death, we know that there is a problem, and those problems require comprehensive solutions. They require long-term investments, continued resourcing, and they require conversations like these, frankly, so that they can in some way be a spark to help people understand where we can make an individual impact.
And if I could jump in, also too, there's one thing that you said, Cinaiya, that resonates so much about humanity. I think I don't know about you, there's two parts of it I want to pick. It's one, I think we have such negative culture right now, online, and a lot of we have to look at that, and it just breeds this let's cut somebody. How's the easiest way that I can cut you down or give you a zing or so forth, and it just becomes, how can we make fun of? And we have to realize how it affects this generation, this younger generation that we're talking about. It promotes, if you see it within our adulthood, we see it in our politics all around. It's this bullying, this is a lack of respect for each other, which now falls down into that other generation, and it removes the filter of bullying around. So even for that alone, and that is a barrier. It's a big barrier that we have to think about. One of the barriers of care, period, is people's fear. Are you going to bully me? Are you going to talk bad about me? Are you going to, what are you going to expose me about? And even to that point, aside from the kids, I think when we have to think about our caregivers, our educators, and even in that, where it becomes, I call it like the Instagram error, where it's more about making fun of somebody rather than a healing. We have lost a humanity.
Yes.
Right. And if we look at it on multiple ends, even as me, that if I'm providing care and I'm absorbing these, there's the negativity will fall out into the care that I'm providing to others. The biases that I'm taking in is going to fall out into the care of others. And specifically with the youth, and these are where I'm going to go back to what my son says a lot. And this is what was shared with some of when we started this program years ago, we started an adolescent program only because of the amount of pregnant young teens over there. And it wasn't just about the pregnancy, it was the things that were happening in the community. And when we started listening to them, they brought up so much more than we even thought about. And they had to be part of it. They had to be part, because they brought up, what are you going to do about our schools? Not about the students, about our professors. They said, because in Haiti specifically, there's a way that we communicate, and they're like, we're scared to approach. Can we talk about that? Can we have training about that? Can we put that on the table? Can we also talk to our parents? So we develop a parent club. There's so much more to it that I think if we're listening to them, that I fear that we don't listen. And then I could get into it, and I'm trying to cut it down. I fear that we don't listen, so that we sometimes create interventions that don't meet their needs. But I also fear that because we might not be listening or not bring humanity in it, that we allow our biases and the things that are happening within the world to overflow into our treatment for our young and youth, our young adults, our youths, our adolescents, our kids in there. I think there's so many into that. I wish we had more time, and I'm trying to break it down, but I would tell you it's two parts: listening and understanding what societal factors are affecting them and affecting us as clinicians, as teachers, as caregivers.
Yeah, I mean, Marc, I totally agree with you. Like, fear is one of the biggest factor, and actually it cripples the community so much. And all this conversation, at the end of the day, you are hoping that someone will listen, but not only listen, but act, do something which is proper and appropriate. And when we talk about fears, I can say it's one of those that I face in my practice every day, especially when, I'm talking to the parents about the problem of their child, and having fear that whatever that I'm going to offer might not work because we're in the wrong side of the country, because of limited resource issue. If this child was in a certain time zone, they will have 3 or 4 different treatment options, and the survival is, it's expected to be good. But because I'm here, I have fear that at the end of the year, I don't know if your child will make it. So, as I said, this fear really cripples our community. And at the end of the day, we do hope that people will listen, but of importance that people will act.
I really agree with kind of what all of you are saying, particularly Marc talking about how we really need to listen to the populations that we're serving and listen to the youth. And I think for us, when we're having conversations about health equity, it's obviously identifying what are those inequities that we're facing, but also having the populations that we're serving be a part of looking for how do we respond to that, so that's a proactive conversation. Particularly at the clinic, we are always making sure that the communities and the populations that we're serving are an integral part of our team, so that, we have a large HIV program. A large portion of our staff are actually HIV positive. We have many staff who are Haitian or Dominicans of Haitian descent. We have young people on our staff. We have LGBTQ staff members. Those are the populations we're trying to reach, and they need to be a part of that team that's reaching them, and I think that makes our conversations much more effective and more based in reality of the communities.
Thank you, everyone. I wonder if anyone else wants to follow up. Like I have another set of questions, but I wonder if you want to respond a little bit on yourself to what you heard the others say, or if you want us to go to the next question. Okay, so there are a few things, there are many things that I heard all of you talk about, but there are a couple that are actually staying with me. One is how intentional all of you are in talking about moving away from the more traditional charity system, which is like really top down and like experts talking to people. And what I find really beautiful about what you are saying is like, this is not something you think you are already doing, but it's something that you are working towards. This is a process, right? Because we are shifting our systems, and you are questioning yourself about how you are listening to the youth in your communities, how you are listening to communities and having traditionally pushed outside the benefits of the traditional institutions. And but I also hear the four of you talk about how do we actually create structures and create programs that allow us to communicate and actually support people to walk away from like this trap. Like, this is your reality and there is no way that you can escape from that. And there is a lack of hope that is there. And the four of you are talking about and calling to the need of actually like creating a structure for possibilities to not only emerge, but to see the possibilities that are already there and work with people to create together those possibilities. So those are things that are emerging from what I'm hearing all of you say. And I wonder, based on what you all share, what is next? What is the path ahead for your organization? And what is the goals that you have to further address health equity for young people in your communities? But also in the context of these topics that you have been highlighting are so important in the way that you see the work and it should be done to actually be in relationship with young people and effectively address health inequity in your own communities.
Maybe I'll go first on this one, because I'm always excited, because my answer to this question really is about our support from CPI. So CPI has been supporting at Clinica Familia, our adolescent health and development project, and we're actually just finishing our first year of that project. And it's been absolutely key in helping us to address health inequity for young people here in La Romana, because this project really is allowing us to go beyond health services, such as HIV care and treatment, which of course are absolutely fundamental, but are not at all sufficient to adequately address the social determinants of health and ultimately to respond to the health inequity that we have in our community. So this project with CPI support is allowing us to respond with individualized, person-centered, trauma-informed case management for each young person in the program. And it's really also allowed us to open up opportunities for them educationally and professionally through scholarships, internships, and job readiness programs, something that we haven't ever been able to do previously. So it's increasing their access to mental health services, not only at the clinic, but also through our support groups, through our summer camp, but also this project has allowed us to do community-based mental health services and provide them that kind of support out in their homes and their community. So our goal moving forward is to increase the number of young people that are being served with these wraparound services. And we think that this will ultimately help break down some of the inequities that exist in our community and for young people.
I can go.
Oh, go ahead,
That's
Dr.
okay.
Esther.
Thanks. So for me, I can say that knowledge is powerful, very powerful tool. And yes, we can make noise about all the treatment outcomes and all sorts of things, but it is a partnership, and we do know the role of CPI in trying to help with this inequity. So we have actually concentrated more in awareness, so empowering our community with proper knowledge about cancer, pediatric cancer. In our community, like it's kind of like a taboo, but also the community does not believe that children can get cancer and actually that it can be curable. So by creating awareness, we hope that the community will be empowered with this knowledge, but also we believe that it will help us with one of our biggest challenge right now is late presentation. So once the community is aware of that cancer is present, how does it present and which areas that they can access care, I think it will really help us achieve that. So with CPI, they had actually helped us develop awareness brochures, which we're actually using them to educate the families who are coming in the hospital, but also the neighboring doctors who work in small hospitals, who are actually very instrumental because these are the ones who send patients to us. So as I believe that everyone has a role to play in this situation, and one of the easiest and cheaper ways to tackle this is empowering the community with knowledge, and that is what we are focusing right now.
For us, we're going to continue to do the work to help pull young people out of deep poverty and using education and career pathways as the means to do so. We know that the cycle of poverty is broken by living a financially sustainable life, right? And we know that that comes by having a degree or an in-demand skill or a trade. So the more that we can focus on economic mobility and addressing the poverty issue, the more that we're able to combat health inequity for the individual. And the honest truth is the system will probably always be broken because it's more profitable that way. So our service is centered on the individual lives and how we carry that forward to carry us forward. So for the Children's Place Association, it looks like a comprehensive wraparound model that infuses what young people actually need. And to echo what Marc said and what Mina has said, what does it really mean to listen and to understand what the true needs are as opposed to assuming what we think they are. And one of the things we found, and I'm sure we can all relate, it's mental health care, it's the academic readiness and support, it's those college and career pathways, and it's helping to keep them safe and engaged in their own wellness and engaged in their communities in positive ways.
Absolutely. There's one thing, years ago, for several years, I taught a course called Practicing Medicine as an Outsider. And it's for all clinicians. It's not just for physicians, it's for social workers, physicians, nurses, you name it, part of the social medicine course. And one of the things that we noticed, and practicing as an outsider doesn't mean that you literally have to be from another country. What we talked about is just because if you're from a different community, you're an outsider. If you're from a different age group, you're an outsider. And it's recognizing, it's really getting to the point of those biases. And one of the things that we push, and we're continuing to push, is really how do we break down the barriers that we as providers put in place for youth to come get services, whether it's mental health services, whether it's health services. And when I'm talking about providers, it's not just a clinician. I'm talking about from the security guard. We're talking about from the housekeeper. We're talking about from the point of entry. And so one of the things that we're trying to do is and actually the funny thing is, actually, you guys, we used some funds that Children's Place gave us to start this. Our first start was training housekeepers, the security, those people that there's going to be the first contact, because the first contact will turn them away before they even get to us, who's, again, why are you here? Another attitude that they have to deal with. So they don't want to come. And I'll tell you, this is from me being a youth this is years back ago. And I remember how I felt. and I have a negative impression of clinicians. I have a negative impressions going forth, and I won't seek help. And those are barriers. Those lead to inequities, and we don't realize that inequities just don't mean because of the location that they're in or the distance to get to this. Once they go pass through all those barriers, when they get to that door for seeking care, then we throw up another set of barriers. So how do we address the biases that we have with youth? How to address what we're hearing because we haven't taken the time to get to know them or get to know that community and what is affecting them. So at this point that we become an ally, we become a friend rather than we become a judgment or just a for lack of better, sort of like this presence rather than breaking down those barriers. So one of the things that we're really pushing, and we encourage all of our staff when we started this adolescent program, is you're going to go into the community, you're going to walk a mile in their shoes to really understand, because before we start even providing care, you need to understand what they're coming from, and maybe you'll put down your barriers and remove some of our biases to actually hear what they're saying. So then we could tailor what we're doing to them. I think I push a lot. Our team pushes a lot on addressing the biases, that we have to really remove those barriers. At the same time, there's something that you guys said is, I am a nurse and I love being a nurse, but in my community, all they really see as opportunities, Cinaiya, you said about economic growth, they see nursing and doctors. I want them to see other people besides nurses. That is not the only path, because you know what? Not a lot of them are going to have the opportunity to go to nursing school or medicine. There are engineers, there are other things. So how do we expose them to others that are doing well so that they could see other pathways? Because if we give them a narrow pathway, then we just put another barrier in there. So there's multiple aspects of it. Again, working on the providers or the clinicians or non-clinicians, whoever's going in there, on the adults, let's just say that, working on adult stuff. And then now also opening other avenues that they could see where they can go.
Thank you, everyone. So I would like to ask you the last question from me, and then we will open up to the rest of the people who have come here to listen to all of you. So as we mentioned before, actually John mentioned before, this conversation is the kickoff to Children's Place annual Place the Hope campaign. And over the next 3 months, many of the people in this call are going to be talking about the work and all of you are doing, and asking their friends and their family and their colleagues to support the work and that all of you are doing internationally. So what would you like to say to them? So is there something that we should keep in mind as we advocate for the work and as we engage our friends and our family and as our colleagues, so they also support all of you? What comes to your mind? How can they support you in advocating?
Can I say, okay. One thing I tell my team a lot is I tell them, don't complain, bring a solution. I would say to a lot of people right now is, we can't complain of what's going to happen in the future if we don't invest and try to do something today. Again, I'm going to go back to what I saw, and we were worried about what we saw in Haiti in 2010 with all these kids. In 2011, actually, saw a lot of kids on the streets. A lot of kids had nowhere to go. And we're saying something's going to happen in the future, guys. We were talking about that. People were saying we need to do something for the kids. We needed to, and we didn't. And we're reaping part of what we sowed or what we did not intervene right now. And it's hard to say, and like even moving forward is, are we going to complain when we get to the future of what's happening in our society? Or are we going to intervene and see what we can do now? Because it's going to affect all of us. And that's where I'm like, yeah, it's not complain, but bring a solution, or how do we be part of that solution? And that's what stays in my head.
Wow, when I listen to Marc, and it makes me think about, and I don't know if where I heard this or if I made it up or if it's a riff off of another common saying, but we're only as strong as the least among us, right? So being motivated by that common sense of decency and collective identity as people, despite all of our differences, whatever they are, wherever they come from, whatever they're rooted in, we are people. And if we get back to what that means, if we get back to valuing that, and to echo what Marc was saying, if we instead of taking the path of least resistance and going and hiding under a rock and saying these problems are unsolvable, and doing what we can do right now so we mitigate the consequence moving forward, right? And yeah, I think if I think about the stuff that motivates me in this work, we get daily reminders. I'm sure that's the case for all of us, that despite all odds, your efforts are still yielding beautiful results. And so when we see young people on the path of self-discovery, or we see them walking toward the promise of a future that is brighter because you and your organization and your work was involved in that absolutely helps to keep you going. So when we think about how to help other people, enroll more people in this work, for me, start with the motivation of the heart. Start with why you get involved, with why you do what you do. And again, think about how you're mitigating future consequence to what Marc was saying, because it's a real thing. And if we take the "it's not my problem" approach, it will soon become your problem if it's not your problem already.
I love what you said, Cinaiya, and about like starting with the heart, and kind of like how this really is truly making an impact for youth. First I just want to thank all of you that are on the call, because you're already have been taking the step and have already been, supporting the work of CPI and Child Thrive. And I know you're going to be going out and asking other people to also support that work. For me, I think what inspires me, and when I'm hearing about, obviously the work of all of you is inspiring me, to be honest. But I also think it's helpful to think about a particular youth who is being supported. And so I just wanted to tell you all a little bit about, I'm going to call her Elizabeth, but many of you who came to the DR on previous CPI visits have actually met her. Some of you met her at a home visit. Some of you met her here at the clinic. And she is an adolescent, a youth who's living with HIV, and she's been receiving care at Clinica de Familia since she was a little girl. And she just graduated from high school a few years ago, and she'd been dreaming of becoming a nurse. She really wanted to provide care to others and support others in the way that she felt like she had been supported by Clinica de Familia. And that's one of the things I think she said to the CPI visitors who came down here. But her family was very poor, and they had no way for her to get a nursing degree, to go to university. And I'm super excited to report that because of our CPI project and support we're getting, we are able to provide her with a university scholarship. So she's actually our first recipient of a university scholarship. And she started nursing school last month. So she's only been in school for a month, but she's having an amazing time. She is in touch with our social worker on an almost daily basis to say how it's going. Very positive. And, when we just think about like what an impact this is going to have, not only on her life, obviously we're opening so many doors and opportunities for her going forward, but also for all of the lives she's going to touch as a nurse, as a caregiver. I mean, it kind of blows my mind, honestly. And I just want to say that is the work that CPI is doing in other countries. They're doing it here in the Dominican Republic. We've been doing it in Haiti for many years. It's like, making a change in one person's life isn't just changing that person's life, it's changing the context of their whole community moving forward. And so I just think keeping those types of stories in mind, sharing those stories when you're going out to talk about the Child Thrive Initiative, I think is kind of how I would go about it. And so I'm just glad to have this opportunity to thank you all for the amazing support that you've been and will continue to provide.
Yeah, I think I agree with my colleagues. The experience has been phenomenal, and thank you so much for this opportunity. Looking into my field, for starters, the survivorship of childhood cancers in low and middle income countries is very low. So we're talking around 20%, while in high and middle income countries is around 80%. So there is a huge survival gap. And the reasons are many, access to care, resources, poor advocacy, the list continues. And I believe that everyone has a role in this fight. My colleague said that, if you think like if the problem is already at your doorstep, it's not my problem alone, it's the problem, it's everyone's problem. And I think that everyone needs to take a stand about childhood suffering. So now specifically with pediatric cancer, there's a lot that we can do, and it's actually not all about money. I mean, there is a stand that you can take, a teacher, a nurse, a doctor, a social worker. There's always something that you can do. You can teach, you can advocate, you can build capacity. There's a lot that you can do. So thank you for thinking of us, but also for being part of this great initiative as well.
Thank you, everyone. So let's open it for questions. You can either put them on the chat and I will read them out loud, or you can unmute yourself, maybe raise your hand so I know how many people want to ask questions. But let's engage a little bit with everyone in this space. So while the questions are coming, because everyone needs time to write, and everyone needs time to write and think about how they want to phrase their question. There are a few things that actually came up to me while all of you were talking, and I think I heard this from all of you, and it's like this is everyone's problem, right? Like we are not here just to help the other because the other cannot live without me, but we are here because we are humanity, and your well-being is attached to mine. And I think that's a message that I'm hearing from all of you, is like, do this work because this is important for the survival of humanity and for the well-being of everyone. Carol, if it's okay, I will read your question unless you want to unmute yourself and share it with everyone. Okay, I can read your question. How do you continue on with all the hate out there? What keeps you passionate and motivated to stay in this work?
For me, the hate itself is a motivator, to be honest. The notion that, because I am an eternal optimist, I wear that badge very proudly, but the notion that the very thing that you are purposing against me and a group of people or whatever the case may be, I'm going to turn that into light and into love and into collective responsibility. I'm going to turn your hate into joy. So to be honest, the hate itself is a motivator because I know that love will absolutely conquer that hate. And so if we spread love, if we spread light, we diminish hate, we diminish darkness.
I would say it's hard. It's hard, and I think and I totally agree. Like that becomes part of our motivator, and they're not my focus. The hate is not my focus. I will stand against it. I will use my voice again. I probably would go to jail for it one day, Lord knows. But I will defend against it. But they're not my focus. I think what we stand against, or we stand for, more than against the hate, we stand for what we're fighting for, and we're fighting for youth. We're fighting for those adolescents. We're fighting for that person in front of me. And so the same way that I will stand in front and fight for my son, I feel the same way I'll stand in front and fight for my patients. Those are coming in. And I think that's the thing is, aside from that, with coming in, we're going to use our voice. I think we are all, and I love being in this panel, powerful women that are not scared of using their voice. So you probably hear us talk very strongly against stuff that we're faced with, and probably not cower in front of it. However, that's not what we're standing against. We're more fighting for. I think that's the difference in there. And I don't assume to talk for anybody, but I feel like I'm in the company of women that fight for things.
No, I think you're right on, Marc. And I think for us at the clinic, it's showing that we can work with love, like Cinaiya said, like we are looking towards the light. We're showing that it's possible to provide welcoming, loving services in the face of the hate that's out there, but none of that is welcome in the clinic, and that it's a different way of providing care, and it's a different way of receiving people with humanity, and that it is possible. It is possible, every single day. I mean, really what inspires me is, walking through the clinic, going, seeing who's up in our pediatric department, seeing the, adorable little babies that are coming and getting care that are HIV negative because they got support in our clinic, seeing our youth who are, like Elizabeth, who is now in college, things that we never could have imagined 5 years ago or 10 years ago, maybe even 2 years ago, we couldn't have imagined it, all of those things are what inspire me every day to keep doing this work.
So luckily for me, I actually have very little hate in my line of work, but what keeps me going, I can say a lot of coffee. But I have this saying which it's kind of my motto every time I work with children, is that every life is special, every life is precious. And fortunately, I'm also a mom. So every time I walk in the wards and see children suffering, I reflect back to my kids back at home. And, I strive to help so that every mom can be happy, or can have hope in the life of their children. Because you never know whether you're going to treat the next Barack Obama or something. So as I said, every life is precious, and yeah, that keeps going.
Let me share a last question with all of you. People are sharing also in the chat about like what gives them strength. And there is a question about this. It's pretty much related. Like this work is a lot, like all the stories that you are telling us, and you are directly dealing with the pain, but also with the dreams of young people in your own communities. So what keeps you focused? Because it's really easy to just like lose track of everything because there is so much going on. So what keeps you focused on the mission? And I will amplify a little bit more, like the mission of your organization, but also your own mission. Like what keeps you focused?
I'm going to jump right in again. My phone batteries are going to die. It's already closed off in a second. I think that I don't know how to say it more so than, and I am totally bathed in the Kool-Aid of my job. I love what I do because the mission is the people. It's right in front of you. And I think that's the focus. It's hard. There's so much going on, but I think we're also looking at the big and the narrow at the same time. So I'm focused about, in the big words, the injustices, but I'm also focused about that one person in front of me, that person that has the name in front of me, that we're going to fight for you to get you that opportunity. So in that person, it also becomes part of the mission because you represent so many others. There's a face to it. So I think what keeps us focused is every time I encounter another person, another youth, another child, another thing, and that becomes my fight again, or continue with that fight for our team. And I don't know. I guess it's more about the patient, and I don't want to say it about the person rather than just the mission, but the mission is tied into the person. I know it's a Pollyanna saying, but we're not totally Pollyanna because we're also warriors at this point, but it really is what keeps us going, or keeps me going.
I 100% agree with Marc totally. Like it's all about the person in front of you, you know, and it's never about the numbers. It's never about, you know, achieving greatness, but it's the life that is in front of you.
And I think it's also about knowing that we can't solve every issue. We can't, you know, there is a lot going on, and knowing like, okay, what can we change? What can we help with? Where can we intervene? What does this person actually need in their own words? You know, really listening to them, and then doing what we can. And I think you can't work in this area if you do get overwhelmed by everything that you can't solve, because there's a lot of things we can't solve. But I think just focusing on the things that we can achieve and celebrating those, and yeah, that's definitely what keeps me sane.
I absolutely echo that, Mina. And it can be hard, right? Because we want everybody to do well and be their best, and so it can be hard to keep focused on the things that we can do, but that's absolutely a true statement. And celebrating, as you said, when you get a win, because sometimes they can be few and far between, but we are cheering on every Elizabeth and every other young person in our care that is doing well and that is striving to do well, even if they haven't gotten there yet. Just the fact that they have the desire to get further than where they are at any given moment, that is a motivator. Their desire to be better motivates me and helps me to want to be better too.
Thank you, everyone. I think we lost Esther. Oh, no. Oh, yes. John, I think you're coming next. Thank you, everyone, for coming. And John, the floor is yours now.
Thank you so much, Claudia. And thank you so much to all of our panelists, Cinaiya, Marc, Mina, and Esther. I was just truly blown away by the conversation. I think this is really the conversation I needed to hear today. I think with all the headlines in the news, you know, all the difficulties that are happening in the world, to hear your hearts and your minds as we work together on this, you know, on this issue of health equity or health inequity, really truly inspirational, and I'm absolutely humbled by the work that all of you are doing. And I would also say just incredibly grateful for the partnership that we have with each of you, with your organizations and your teams. I would just kind of close out things with a couple of more points. One is that if you're inspired today, as I'm sure you were, please get involved with the Place the Hope campaign and support the efforts of the partners represented, the organizations and partnerships represented here today. And we'll be putting some additional information in the chat, I believe, to help with that. And there it is. Catherine has just put it into the chat. And then also, this campaign is going to go through the end of the year, and we are going to have an end of year campaign celebration, which will be live and in person for those who can join on December 5th at Chicago's Botanic Gardens. It won't be outdoors. You'll be happy to know in December in Chicago. We've got a beautiful room there to take stock of the campaign, and of course the impact that all of you are making. So that'll be on December 5th. So stay alert for invites, and I hope you can join. And then finally, just a huge thank you to everyone else who was able to join in the conversation and participate. Claudia, special appreciation to you for your moderation and the work that you do. And we'll look forward to hopefully seeing as many of you as possible on December 5th, and of course between now and then in other formats. So thank you again, and I hope everyone has a great day.